Very good morning, everyone. I am Dr. Palak Majmudar, member of Placement Committee here at IIPHG. Uh, we,
I am Dr. Shrey Patel.
we are absolutely thrilled for all of you to be here today. I welcome all of the dignitaries, faculty members, and all of my dear friends and my seniors to the most important part of ACES 2024 conference, our career talk. I would like to extend a warm welcome to all of you. So whether you're just starting to think about the future career or already exploring new opportunities, today's session is all about helping you gain valuable insights and guidance as you navigate through your professional world.
So how are you guys? Good morning. Good morning, everyone. Morning. So yeah, we are really excited to be a part of this experience with you, and we hope that today we all live with the feeling inspired and ready to take part for the next step for the professional goals. So without any further ado, let's get started and make this session a successful event. Thank you for all being here, and we look forward to an inspiring and productive sessions.
I urge you all to get your notepads and your pens out to take notes. We'll have a 5 to 10 minutes round at the end of the session for your questions. So keep them collected in your notepads and we'll have them at the end, right? So now I'd like to invite Dr. Apurva Kumar Pandya to chair the event. Dr. Apurva Kumar Pandya is a trained psychologist and social and behavioral scientist, currently serving as a faculty member at the Department of Health Policy Management and Behavioral Science at IIPHG, Gandhinagar, Gujarat. He also leads the Center for Quality Improvement and Patient Safety. With over 17 years of experience in the social sector, Dr. Apurva has worked with grassroots organizations, UN agencies, and international NGOs specializing in HIV prevention, child protection, and health. His research interests include health technology assessment, patient safety, mental health, and behavior change communication, particularly focusing on vulnerable populations such as LGBTQ individuals, children in juvenile settings, and women.
So also has published around more than 100 papers, including 10 book chapters and 6 books, and also holds an H-index of 16 with over 1400 citations. He currently manages 4 projects and has completed 6, including training programs and health management and communication skills. So as you can see, he's a renowned expert in the field. So we hope, sir, that we get your all insights. So
Let's welcome him with a big round of applause.
yeah.
Now I'd like to invite our moderator, Mr. Ajay Singh Parmar, our placement officer here at IIPHG. Mr. Ajay Singh Parmar is Senior Associate at IIPHG, where he supports in managing internship. He collaborates with industry partners for dissertation and placement progressive opportunities, secure diverse internship students, gain valuable real-world experience. He plays a pivotal role in India through their dissertations, maintaining high standards of academic and research excellence. His commitment to the students' success extends to alumni networking. So let's welcome him with a big round of applause.
We welcome you, sir. So beginning the procession now. Now I'd like to welcome Group Captain Ravinder Singh. Sir, please come on the dais. Sir completed his school and college education from Bareilly, UP. Group Captain Ravinder Singh was commissioned as a pilot officer in the education branch of Indian Air Force in June 93. He was enriching career over 30 years with IAF and also have served as an instructor and administrator in training Eastern at Air Force Station and headquarters. So we are really grateful to have you, and we are looking forward for your insights. So I'd like to call upon Dr. Vijay sir to felicitate him. Sir, please. Thank you, sir.
Now I'd like to welcome Anup Gopal Krishna Nair, Senior Director of Corporate Services, Piramal Foundation, onto the dais. Dr. Anup Gopal Krishnan Nair is a seasoned HR leader with over 20 years of international experience. As the Senior Director of Corporate Services at Piramal Foundation, he oversees strategic initiatives for a workforce of 5,000 employees. Holding a PhD in Human Resource Management from Delhi University and a General Management Program degree from the Indian School of Business, he has been instrumental in onboarding 8,000 professionals within 3 months. Dr. Anoop's expertise spans talent development, corporate governance, and performance excellence, earning him multiple awards, including the Golden Globe Tiger Award and the 101 HR Super Achiever Award. Please welcome him with a big round of applause. And I'd like to call upon Dr. Shabana Khan to felicitate Dr. Anup.
So next, I would like to call upon Mr. Paresh Kumar, co-founder and CEO of Dev Insights. Welcome, sir. Uh, so he is a co-founder and CEO of Dev Insights, has over 24 years of experience in social development, specializing in research, monitoring, learning, evaluation. He has also led over 200 large-scale research industry across like public health, education, WASH, and livelihoods. Mr. Paresh also works closely with policymakers, donor agencies, and cooperates to data-driven decisions. As managing trustee of the Lilly Foundation, he fosters community upliftment. Also, he's also an author, publishing in prominent journals like The Lancet Global Health. Mr. Paresh is a frequent contributor to publications like Economic Times and Financial Express. So I'd like to call upon Dr. Harsh to felicitate him. Please, sir. Give a big cheer, guys.
Now we have with us Dr. Ridhima Kamal, Chief Manager, Collaborations and Partnership at Arogya Seva. Please grace your presence on the dais, ma'am. Dr. Ridhima Kamal, a dental surgeon and public health professional, is the Chief Manager of Collaborations and Partnerships at Arogya Seva Global Health Volunteer Alliance. She co-founded the Public Health Professional Coalition for Global Impact, which connects public health professionals to resources, job opportunities, and networking. Specializing in non-communicable diseases, Dr. Ridhima has worked with global institutions such as WHO India, AIMS New Delhi, and the World Bank. Her work focuses on integrating technological innovations and professional expertise to advance public health both in India and globally. I'd like to welcome Dr. Smita to felicitate Dr. Ridhima Kamal with a memento.
So the next expert I would like to call upon Dr. Hardik K. Shah, Hospital Administrator at Dr. Jivraj Mehta Hospital. So Dr. Hardik Shah is a hospital administrator administrator at Jivraj Mehta Hospital, bringing over 16 years of experience in hospital administration. With a background in physiotherapy, healthcare management, and operations, he oversees hospital operations, HR, finance, marketing, and quality management. He has held key roles in hospitals like Apple, Usha, and Nidhi Hospital, and also served as a Gujarat state head at Emlia India Healthcare. He is an executive committee member for the Gujarat State AHPI and a member of Indian Association of Physiotherapists, contributing significantly to healthcare quality and operational standard. I'd like to call upon Dr. Yashoban to felicitate. Sir, please, sir, come on the dais. We'll be joined by other two experts in a short moment of time. So meanwhile, we'll begin the event. So now, over to you, Palak.
I'd like to thank you all again for gracing the dais with your presence. We are really looking forward to hear from you and your valuable insights. Are we excited? Do we have any questions ready yet? I am sure we do. And within the discussion, we'll be enlightened with a lot of knowledge, and a lot of questions might arise during the discussion. So I urge you all to keep all your questions ready. We'll have 5 to 10 minutes at the end of the session for all of your questions. So are we excited? All right.
I'm
Let's
sure.
get started.
I'm sure it's a chilly morning right out here, but you will warm after this session. You will warmed up with knowledge and your future career opportunities. So, are we excited, guys? Thank you.
All of us are tired from last night, isn't it? Looks like it. Yeah, they're just waiting. All right. So let's start the session with Wing Commander Sanjay Kumar, currently serving as Senior Education Officer in the Southwestern Air Command.
I'm sorry.
Sorry, Group Captain.
Ravinder Singh.
I'm really sorry.
The stage is all yours, sir. Welcome.
I'd like to welcome Group Captain Ravindra Singh, Senior Education Officer. Please, sir, come for your career talk. Thank you.
Okay, thank you. First of all, I would like to thank Director IH for giving us the opportunity over here to come and interact with you and share our experiences and tell you something about the career in defense services. So, as you know that I am from the education branch of Indian Air Force, and I have almost 3 decades of experience in training. And especially we are the branch which are looking after the HR development of all the air warriors. So keeping that in mind, we have been detailed to carry out such interactions with the institutes, the students, and tell them about defense services, and to be specific about Indian Air Force. So, well, before I start my career talk, one thing which I want to share is, I want to know is that how many of you are already doctors over here? Just raise your hands. All are doctors. Okay, please, good, good. And this will be my first experience to address so many doctors. Anyway, and how many are non-doctors over here? Okay, so I can just say that around 75-25% ratio is there. And you all are doing your post-graduations over here in various streams. So I'll be focusing my talk about the career opportunities with your qualifications, because otherwise defense services offer career to the undergraduates also. And from 12th class onwards, you might be knowing about National Defense Academy, which offers wonderful what you call exposure to officers, cadets, and all those things. But for you people, I have devised certain presentation which will be focused on medical also and non-technical entries also. And before I start, one more thing I would like to ask you all. What is the hallmark of excellence in any career? Anybody can, and I have got a prize also for each answer. Okay, I have got a prize for each answer over here. What is the hallmark of excellence in any career? Anybody? Yes, please. Very good. Continuous learning. Just hand over one cap. You may come, please. And I'd like to. इधर दे दो मुझे दे दो उनको इधर आने. Please come over. Very nice answer. Learning, as she's rightly said, and learning is directly associated with leadership. Leaders always keep learning. They learn, they share, and they share the joy of learning, and then keep moving ahead. It's a cycle. As a student also you learn, when you become a doctor, when you go in any profession, you keep learning. This cycle of leadership will continue throughout your life. And the leaders will never stop learning. And why we joined defense services? Because this is a place which gives us ample opportunity to hone our leadership skills. In any department you go, in whatever capacity you work in defense services, you will get an opportunity to hone your leadership skills. And why we need to hone our leadership skills? Anybody? Why? Yeah, please. If you can just introduce yourself.
My name is Ahmed Hashmi. We can achieve, it's like a leadership continue, we'll achieve our dreams.
When you achieve all things, what does that mean?
It's like we can continue doing the leadership, we can achieve our dreams.
Achieve your dreams.
Yes.
And when you achieve your dreams, what happens to your life?
I will be happy, that is.
So basically you are saying that you will improve the quality of your life.
Yes.
Happiness is the wholeness.
Yes.
So we need leadership skills to improve the quality of life. I'm telling you very basic, common sense things only. Thank you. You can please come over and get your souvenir from here. See, I want that this interaction continues. Okay. So now I think we are comfortable. We know each other. Before we get into the formal part of it, so why we are here and what we are going to do. Indian Air Force, a cut above. Well, I would also like to share a bit of history about IAF. You may know and some may not know, but I'll give you a very short introduction about IAF. Well, it was a scheme committee which was established by the Britishers in 1925, which recommended the training for Indians in Royal Air Force College at Carnival in England. The 6 Indians were selected for the first batch, out of which only 5 passed out. And in 1932, 8th October, Royal Indian Air Force was born at Drig Road in Karachi. So we are now a 92-year-old force. So first, number 1 squadron was established with 4 airplanes. They were Vapatis, 5 pilots who had cleared from Royal Air Force College, and 9 technicians. So you can see that how we have come over such a long period, and that royal prefix was dropped after independence. So now we are Indian Air Force, which has developed as an independent and a potent arm of Indian Defense Services, which you all know. So I have got some pics of from the archives, like this is Vapati, A flight number 1 squadron being inspected in 1936 at Kohat, again in Pakistan. Then the Air Force pilots, Indian pilots, they first participated in World War II. So Air Chief Marshal Arjun Singh, and he earned a Victoria Cross also for that. So these are some pics of that time. Of course, then after independence, we had series of wars with Pakistan, the first being in 1965. There are some pics of that time. At that time, we had nets in operation. So these are the net aircrafts. Then coming to Indo-Pak War of 1971, Battle of Longewala, which you have seen in movie Border. So that was fought, and in which Indian Air Force participated and supported the ground forces. And the Patton tanks of Pakistani army were destroyed by our fighters. MiG-21s were there at that time, and Marut. And yes, of course, the sole Paramveer Chakra of Indian Air Force. There are many Paramveer Chakras in Army and none in Navy and 1 in Air Force. And that is Flying Officer Nirmaljit Sekho, posthumously. He earned this Veer Chakra while in service and while fighting against Pakistani Air Force at Srinagar. Yeah, and of course, everyone knows about this Kargil operation, 99, in which it was not a full-fledged war, but it was a limited operations. We call it low-intensity conflict, where armies were not directly fighting with each other, but they were proxies fighting with our defense services. One question over here. If you know about Kargil operation, well, the army named it as Operation Vijay. Are you aware of it? What was the name of Air Force operation in Kargil operation? Okay, one is there. Anybody else from that side? What was the name, code name of operation, Kargil operation? Anybody? Yes, ma'am.
Safed Sagar.
Very nice, good. I have got 2 people. Please give her a big hand. Please come over, ma'am. आप भी आ जाइए. So Operation Safed Sagar was the name of operation which was conducted by Air Force during Kargil operation. Well, one more, the slide is not there. I give more chance to people. What was the code name of Balakot strikes? It's all over in media now. What was the code name of Balakot strike? Yes. Operation Bandar. Very correct answer. Please come over for your souvenir. It is quite heartening to learn that people know about all these things. And these are such platforms where we share these things. Thanks a lot. Well, now we come down to the crux of my talk. talk about career prospects. Well, talking about types of entries which we have in Indian Air Force, like we have entry through UPSC, which is not, of course, now you're not eligible for it because it is, of course, after FCAT, then Air Force Combined Entrance Admission Test, which is for graduates, non-medical only. I'm talking about non-medical. So whoever is non-medical over here, they have an opportunity to appear in FCAT, which is conducted twice a year in February and in August. The registrations will start in December for February, and for August, they start in June. So one FCAT entry is there, where you get to go into flying branch also, in technical branch also, and non-technical branches also. Then there is a meteorological branch in our Air Force, which is very critical because we want to know about weather. So we have a separate meteorological branch. So there is a separate entry for that. Then we have a NCC special entry. This is NCC C certificate holders. This comes as in when vacancies are there. So NCC C certificate holders can also get direct entry in Indian Air Force, especially if they are from NCC Air Wing. You have to be from NCC Air Wing to get into Air Force. Then SEC is not for you people, but it is for Service Entry Commission. Already, the ones who are already serving, like airmen who are there in Indian Air Force, they get an opportunity to apply for officer cadre through Service Entry Commissions. Now, types of commission. There are two types of commissions. Like in all other services, we have permanent commission and short service commission. Now, short service commission is being encouraged, whereas permanent commission is only available through either NDA or CDS. FCAT, everything is short service commission. Well, I'll talk about doctors in armed services. So there are few, where's the pointer here? Forgot to take the pointer. Okay. So this is a common direct entry into Armed Medical Corps. This is Army Medical Corps, which will take the entry, and the officers, medical officers are divided in all the three services. So that is why it is common direct entry in Army, Navy, and this is for direct doctors. And they are given 5 years service, and then as a SSC tenure, which is extendable to another 5 years and extendable to another 4 years. So advertisement is carried out twice a year in July and December. So this is the time when you can look for the advertisement. Entry, now for PC, if you want to go for permanent commission as a doctor, then you have AFMC, as you all know. But now probably you have surpassed that age also, because you all are already into your PGs. But yes, for PG also, you might be knowing that we offer PG courses in all our research and referral hospital and command hospitals. There are vacancies for PG also, with a 5 years bond to serve. You can do your specialization in research and referral at Delhi, and command hospitals which are located in various places, like one in Pune, one is in Bombay, another is in Lucknow, then one is in Calcutta, then one is in Chandigarh, Chandi Mandir. So we have, one is in Bangalore. So these are the command hospitals which are there all over India, where the vacancies are there for doing the post-graduation. Of course, with a bond of 5 years to serve in armed services. So these are the issues at present for you people. Okay. Now, generally, talking of branches in IAF, we have 3 basic branches: flying, technical, and ground duties. So medical branch is considered separately. They don't fall in the gambit of these 3 branches. So the Recruitment for medical branch is separate. That's why I've showed the slide for that also. So now in this, I'll be only touching upon flying and ground duties. Well, doctors can, if you are age-wise eligible, you can apply for flying branch also as a doctor. I had one of my colleagues who was a doctor and he was doing flying course at Air Force Academy with me. So you can become a flying doctor. Well, in flying branch, as you know, there are 3 streams: fighter, transport, and helicopter streams. Well, in this case, for non-medicos, this will be for FCAT. You have to have this eligibilities: 50% with maths and physics in class 12th, then 60% in graduation with BTech also, and then this is for Aeronautical Society का कोई exam है, उसके लिए you can. These are the eligibility qualifications. Then this is the age limits for 20 to 24 years. If you are a CPL holder, then you get a relaxation up to 26 years for both male and female. Well, training will be there for 1.5 years at Air Force Academy for FCAT. And as I told you earlier, that registration for FCAT will start from in June and December. Exams will be held in February and August. And it's a short service commission. So this is for non-medicos. Well, some pics of National Defense Academy, Sudan block. This is called as Sudan block. These are Pilatus aircraft. These are the trainer aircrafts in which the rookie pilots, they are trained at Air Force Academy. And this is the flying faculty. Now coming to ground duties, again for non-medicos, we have these branches in ground duties. We have ADAM, pure ADAM, ATC, ADAM FC, fighter controllers, which we call fighter controllers, and ATC is air traffic controllers. Then we have logistics, we have accounts, meteorology, and education. I am from the education branch. Okay. I have been given a chit of 2 minutes, so I'll try to finish it quickly now, because I have covered almost all the things. For ground duties, these are the qualifications. Age limit is 20 to 26. 1 year at AFA. Same June and December. It is for SSC. For meteorology, there are certain more degrees which are there, which you can just go through, but which may not be of your concern much. Then this is the selection cycle, like after advertisement, registration, then exam, followed by SSB. We have Air Force selection boards which conduct service selection for the officer cadre, followed by medicals, then final merit, and then you get the joining instructions. There are some pics of AFSB. One AFSB here is in Gandhinagar also. So there are 3 aspects. Actually, these selection process is based on Mansa, Vacha, and Karma concept. Man means your psychology, Vach means your communication skills, and Karm means your group tasks. So there are 3 phases in which one candidate is assessed for almost 4 days, and then final day we have a board conference, and where the results are declared. Well, IF, what it gives you: a life larger than life, quality of life, especially the social status, respect and esteem, adventure, best of facilities are provided to you, be it sports, medical, education, and other institutes, and you earn lifetime relations. So more important. It gives you values which are very rare nowadays, of loyalty, duty, respect. These are all related to the leadership only. So you learn all these things. As an officer, you live them every day. It's a way of life. वो एक हिंदी में स्लोगन है आर्मी का, आप लोग इसको आर्मी कहते हैं, हम इसको जिंदगी कहते हैं. So this is what is all about. Then of course, this is also one of the critical things, but as a medical officer, you will be earning more than 1 lakh as you get commissioned as a flight lieutenant. Other officers get commissioned as flying officers. But you might have heard in my bio that I was commissioned as pilot officer. But now that rank has been abolished. So now we start the rank structure from flying officer only, and it goes up to Air Chief Marshal. So medical officers are commissioned as flight lieutenants directly. And your pay scale will be more than 1 lakh. Why I'm saying more than 1 lakh? Because I have not added the DA part in this. So DA will also be there. So you will be earning around 1.5. Additional to that, perks will be there. These are the allowances. You will be eligible, if you are posted to field area, you will be eligible for field area allowance. If you, as a doctor, you can join special forces also. That also you can do. Siachen allowance also. Then if you are on Andaman Nicobar, you will be getting island special duty allowance. Then hard area allowances. Then field and modified field area allowances. Yeah, most important for you is 20% NPA. Now non-practicing allowance is there. Then traveling allowance, telephone allowance, kit maintenance allowance, newspaper allowance, everything you will get. So this is above that. So your package may become of 2 lakhs. Then perks, well, furnished accommodation at very subsidized rate. It's a license fee which is charged to all government accommodations. That will be there. Then free medical cover, free ration or cash, whatever is your choice in lieu. CSD facilities, of course, you know it. LTC, all the other government facilities which are there for self and dependents, loan facilities, leave, 60 days annual leave, 30 days casual leave, all these things. Study leave also, if you are a PC officer. You get 2 years study leave. Schooling facilities for your wards, everywhere it is available. All Air Force schools, KVs, everything is available. We also have MOUs with many universities for higher education. Then life insurance cover is through AFGIS. A 1 crore life insurance cover is there. And various loan schemes are there, which you get on a very subsidized rate. Well, this is the hierarchy: flying officer to flight lieutenant to squad leader to wing commander. Years are left written, in how many years you become that, and assured career progression of becoming a group captain, the one which I am at present in front of you. After that, you can become Air Commodore, you can become Air Vice Marshal. As a medical officer, you can go up to Air Marshal, not Air Chief. Air Chief is from Flying Branch. Well, adventure, if you people have that knack of adventure, we provide all these activities, air, land, and sea activities. We have a dedicated adventure cell which keeps offering such activities from time to time. So you have opportunity to carry out this thing. It is a wholesome life which the Air Force is going to provide you. Even if you serve it for 5 or 10 years, you will never forget it, and it will shape you for your life. Well, for further details, you can go for the website careerindiaairforce.cdac.in. The other links which are there. And that's all. Jai Hind. Thank you.
Thank you so much, sir, for your wonderful insights. We mark on your words. So, guests have arrived, so I would like to felicitate them. So, first of all, I'd like to call Dr. Rohan Desai, founder and CEO of PlexMed MD and Netflix. Dr. Rohan Desai is a healthcare entrepreneur and educator, blending clinical experience with business acumen. As the founder and CEO of PlexisMess MD and Mediflix, he has revolutionized healthcare communication and education. Dr. Desai, an MBBS graduate and MBA from IIM Ahmedabad, has trained over 1,000 doctors in applying AI to healthcare. He's also a faculty member for the AI for the Clinical Professionals course, a frequent guest lecturer at IIM Ahmedabad and Ahmedabad University. In advancing healthcare through technology and education has made significant impact in the industry. I'd like to call Dr. Apurva to felicitate him. Please, sir.
Dr. Swagam Shah, Senior Consultant Orthopedic and Sports Medicine Surgeon on the dais. Dr. Swagatam Shah is a renowned orthopedic and sports medicine surgeon with over 5,000 successful surgeries. He specializes in sports injuries, ligament reconstruction, and shoulder replacement, and has trained over 50 orthopedic surgeons as a faculty guide for fellowship at the Ahmedabad Arthroscopy. With degrees from PDU Medical College and Civil Hospital and Safdarganj Hospital, Dr. Shah has pursued specialized fellowships in sports injuries and shoulder arthroscopy in the UK and India. He has published extensively in national and international journals, making him a key figure in orthopedic and sports medicine. I'd like to call upon Mr. Ajay Parmar to felicitate him with a memento.
So, to call upon the for the speech. Please, sir.
Hey, good morning. I come to campus quite often. It's the fifth or sixth time that I'm addressing like this. हमेशा ऐसे ही यहाँ पे कर देते हैं. आप लोग ऐसे बैठे रहते हैं और कुछ न कुछ ऐसे आके ज्ञान देके चले जाते हैं हम लोग. Having said that, here I come. The audience changes. Fondant is always the same, and I come with a fancy PPT जिसको उधर से रन किया जाता है और थोड़ा बहुत ऐसे ही के निकल लेते हैं. But I'm proud to say that every year we take almost 20-25 of you from this particular campus for internships and dissertations, and I'm very happy to state that almost 10 to 15 of you end up working with the organizations that I represent. ऐसे डींगे नहीं आंक रहा हूँ, but that's how it is. But this time I just flip the envelope a little and not come with a presentation per se. क्योंकि आप लोगों के सीनियर्स के साथ पिछले साल इंटरैक्ट करते वक्त मेरे को ऐसा लगा कि all of you are smart enough to glean more information out of the web and from the websites from what I can encapsulate in say 5 or 10 slides. तो कुछ तो वो रियलाइजेशन था और कुछ मेरा आलस था कि इस बार कोई प्रेजेंटेशन ही नहीं लाना. Yeah, so having said that, I'm always gratified when I come to this particular campus because have this realization that the majority of you have more or less figured out what you want to be doing with life. Having said that, if I ask at this forum, अभी आप लोगों के बीच में, on the career front, how many of you have figured out what you want to be doing? एकदम clear कि MPH करना है, MHA करना है, उसके आगे? बता दो. Tell me, what is it that you want to be doing? Yes, please. You want to be a program officer, just run programs. That's it. Okay. We can discuss that. We run multiple programs and stuff, but then uski baat aage. Anybody else who wants to do anything other than programs? Yes, ma'am. You want to be what? You want to be an environmentalist. I have no idea what that means, but best of luck for you. Anything other than that? Anything other than a program manager and an environmentalist? और कुछ नहीं है एस्पिरेशन में?
Implementation into nutrition and improving policies for the further growth in adulthood, ranging from 18 to 30 years.
Okay, best of luck to you too. मुझे कुछ समझ में नहीं आया लेकिन ठीक है. So चलिए ठीक है. 25 years इतना भी आप बोल सकते हो तो बहुत अच्छी बात है. ठीक है. 20-22 साल की उम्र में मैं यहाँ पे सिम कार्ड बेच रहा था मैं अहमदाबाद में, वो भी प्रीपेड. Yeah, so when I was 18, 19, 20, I had no idea what to do with life. Yeah, so coming from middle class South Indian family, growing up in Ahmedabad, सरकारी नौकर थे माँ बाप, तो उनकी महत्वाकांक्षा बच्चे IAS बन जाए या सरकारी अफसर बन जाए, but they discounted a very critical fact कि बेटा नालायक है. ठीक है, ऐसी है. ना ही डॉक्टर बनेगा तो BSc स्टैटिस्टिक्स एंड कॉलेज अहमदाबाद. But when I am 23 or 24, I wanted to get. Abhi Sahab just took us through the entire thing. Tried for the NDA twice, didn't take me. Last गए 2 बार गए. ठीक है. और वो शॉकर के बाद, I mean, appointment will stay with me for life. वो जो धक्का लगा था उसका शायद मैं यहाँ पे खड़ा हूँ. हाँ, so yeah. But said that, as of now, I represent the Piramal Foundation, wherein my responsibility is to strategize and implement support service strategies, which comprises administration, procurement, and will support 5,500 to 6,000 people work the breadth of this particular country. So you can strategic business makeups, wherein we work in health, nutrition, digital advocacy, governance practices, public health strengthening. ऐसी बहुत सारी. I'm sure most of you would have actually gone through the website. मैंने देखा अभी बैठे बैठे लिंक्डइन चेक करा, मेरे को 4-5 के कनेक्ट करो. ठीक है. And that is precisely why I do not bother myself with this plan. So you're welcome to connect with me offline. You're welcome to connect online as well. And when Tapasvi sir comes, it's almost an order for me. I cannot refuse him. So you can connect with me through the esteemed as well. But एक चीज मुझे बोलनी थी, that out of, I was most people who would be present here, there will be opportunities, there will be stuff that we can discuss. I'm happy to discuss with you after the session as well. यहाँ पे थोड़ा time constraint है, and then we have an esteemed panel of members who would like to take you through what they have to say. अब 3-4 लोगों में आपने बताया कि बॉस this is specifically what we want to be doing. But the majority of you may still be exploring as to क्या करना चाह रहे हैं, what is the opportunity that we have after we pass out of this institution. So, nothing wrong in that. I was trying to figure out what I want to be doing into my late 20s and early 30s. So, it's nothing wrong to keep exploring, and with the kind of dynamism that we have in the market space as of now, what is relevant as of today may or may not be relevant maybe as early as 6 or 7 months down the line. So reinvention is the constant buzzword which every single one of us has to live by. लेकिन एक दो एडवाइस है which 20-25 साल के मेरे एक्सपीरियंस के बाद मुझे किसी ने दिया था in my 10th year of work. After 10 years in the industry, I would like to share with all of you, which may or may not help you. But मेरे को बुलाया तो कुछ तो बोलना है ना मेरे को, मैं बोल देता हूँ. Please start with some sort of assessment on what is it that drives you as an individual. What do you want to be working on and what would add value to you? That self-assessment is very critical. It's an interesting story as to how I ended up in human resources. As I said, I started off selling SIM cards after the army rejected me twice. Yeah, I started selling off SIM cards, sales, prepaid cards in Ahmedabad in 40-degree heat, 45-degree heat. And then I realized, यार बहुत ज़्यादा hard work है, मेहनत बहुत ज़्यादा है, आगे पीछे का कुछ पता नहीं है, मेहनत बहुत ज़्यादा है, तो आप क्या करेंगे? एक काम करते हैं, HR करते हैं. क्यों? क्योंकि डेस्क जॉब है, AC में बैठने मिलेगा, बाहर मार्केट में नहीं जाना पड़ेगा. That is how I ended up in HR around 20-25 years back. I hope that is not the kind of decision making all of you are doing. समझ रहे हैं? And let me be honest, इतना आसान भी नहीं है HR में बैठना. It's a little tough, and it's hard work. So please start with the self-assessment and talk to people. तो अभी मैं अजय सर से कह रहा था कि when an event like this happens, please ensure that you also call your seniors into this place. I have an esteemed set of alumni who are working with very big organizations who have gained the exposure. I personally know around 50-60 of them. They are still in touch, and they can give you amazing insights into what it entails working out there. Program implementation के लिए तो भाई आप तो मतलब you are sitting on a gold mine. You have almost 60-70% of the alumni is working in program implementation across, I don't know what all factors of health and health strengthening and all. That's a good one that you. However, again, I go back to that please start with your self-assessment as to what is it that you want to be doing. You have had a start, but that's not the end of it all. Post the self-assessment is start making it down granularly. Yeah, once you do that, break it down to smaller goals which are achievable. Thanks, Itan. As I keep saying, I don't know the course content and stuff, and Apurva sir and all say this, by the time you pass out of the college, apart from the basics, everything else is irrelevant because the world has moved on. So once the world has moved on, and once the incumbent of every single walking out into the market to figure out, what is more relevant today. Not to disparage the course or not to disparage an institution, but that's a fact of life. Yeah, I'm still unlearning and relearning stuff that are very pertinent to the kind of work that I'm doing. ठीक है, तो ये goal setting कर लीजिएगा, and वो ज़माना गया कि explore exploratory stage इसी time पे खत्म हो जाता है. As I look at it, every single one of us, even at this stage of the career, with 20, 25 years behind us, we are still in the exploratory stage because a lot of stuff that is happening which we have no sighters on. We have no idea what the world would be maybe 6, 7, 8, 9, 1 year down the line. So I do not know what the future holds. So even we are at the exploratory stage of our career, and आप लोग तो अभी शुरुआत ही कर रहे हैं. So ये जो आप अगर आप सोच के चल रहे हैं कि maybe 4, 5 years down the line we are going to be settled. So I've worked 25 years of my work, of my life. 2 graduation, 2 masters, 1 PhD हो गया, 17 कंट्रियों में मैंने काम कर लिया. I am still not settled. Yeah, so let's not go for that particular aspect. So ये एक चीज है. I think how much time do I have? Or are we done? 1 minute. I'm done.
Thank you very much.
Anything you want to be asking me, then I'm open. I'm done. Nothing that I can say in 1 minute.
So there will
Anything?
be question and answer session.
अच्छा,
followed,
फिर मैं
so
बैठ जाता हूँ. Thank you. Thank you.
Thank you very much, Dr. Anup, for sharing your experience, insightful experiences with all of with all of us. So now, Captain sir has some appointment, so he will leave. So thank you very much, sir, for being here.
Yeah, thank you all of you. And any questions, if they are there, we are just next door. Okay. So you're most welcome. And my contact details are with Commander Smita, who is with you over here. She is a link between us and you. Wing Commander Smita is there. She will be helping you to contact us in any queries and all. You can pose it to her. We will clarify it. Bilkul.
Hello. Thank you very much. All right. So there is one message. Brought materials. Go. You can. Them. All right. Thank you very much. Deliver your task. So time limit, so you can make it short.
Sure. Much. I think I'm cognizant of the time limit that I to wrap it up with the time that is upon me. And I was just telling Anup that you have done a favor to me by making the crowd very comfortable. So that warming session is gone. So 2 minutes of my time I thought I'll put into warming up. I am not going to do that. But thank you very much for the invite. I'm really honored, and it's a pleasure to share my experiences in front of such an energetic, vibrant young students. It's a pleasure to talk about career issues with youngsters. Like Anup was just mentioning, I kind of concur with a lot of that he was saying. IH Gandhar has done a wonderful job of curating such a career talk here. That's phenomenal. That's so useful and important for the students who must be sort of grappling with the thought of what to do next. In fact, I was happy to see that you guys have a lot of clarity. Back in our times, people of my age and my time, This was 30, 35 years back, early 90s. Um, Career counseling was not an option for us. That luxury we did not have. So our career decisions were between dinner and some neighbor giving some solicitor serious. Some Sharma ji saying bank tayari karwa do, railway ki tayari ho jayega. When we used to reach out to our acquaintances, our relatives, trying to understand, hey, what are you doing? Why you're doing this? What is it all about? And of answers that we used to get was my is doing, my friend also doing, running, give it a shot. Seriously, like the children then who excelled in academics were into engineering or medical. The rest of the 90% or maybe 95% had no clue what is to be done. Only bachelor, what next? And so therefore, kinds of career talk, questions, counselings hold a lot of importance and very pertinent times. Although in this age of information technology, where you have information about things and it's ever evolving, but still having this kind of helps having some direction of thinking and exploring what to do, what not to do. And discussing career is really, it is very close to my heart, because I must, confess that by designation I am the CEO, but art I am a person, and I am very fond of interacting with people, and I make it a point that before making a final offer to anyone for any role, for any position, I interact with that person in person, online, or whatever mode. I interact with them and I ask a very simple question, a very generic question. Why do you want this role? Kyun chahiye? It's a very simple question. And you will be, and I get amazed to hear the answers. And when I listen to the answer, I don't just follow the words. I try to understand what beneath. Under kya hai uska? What is it that is driving the person? What is the person really passionate about it? Just sort of saying some rote learned answer just to secure a job. You see, because securing a job is relatively easier, but thriving in the job that you have secured is not that easy. For that you really need to have that drive. You really need to have that passion. That is something that is really going to sustain kind of work that you're in, whichever field that you choose. But that passion is really important. And when people talk to me that, okay, what are the factors that one should think about or consider when contemplating any career option. So there's one, I think, Hedgehog principle or something. So that talks about 3 pillars. The first one is what interests you. So what are you really passionate about? What is something that you can do sitting 72 hours straight without any crankiness, without complaining? Do you have that drive? So that is something that you will have to figure out within yourself. The second thing is what are your strengths? What are you good at? What is the value that you bring to the table? What is the edge that you have? And you have that unique strength within you. And the third thing, and which is really important, is that what is the market demand? You see, because you have you're driven by something, and then you have all those strengths, etc. But then there has to be a market that should be accepting or ready to accept that, right? So these are the 3 pillars that one should definitely think of while considering a career option. In the public health field, there are experts who would really talk about what are the options. But in my 25 years of career, what I can say that, there are 3, 4, 5, career options available, for you. One is implementation. I think one gentleman just mentioned about that. I want to get into programs. So program implementation is one area. You can try and start a job with a community-based organization, NGOs, INGOs, or donor organizations. You can try where there is this on-ground implementation of projects or programs. Then if you think that you are creative and you are good at communication, perhaps you can marry your creative skills with public health thing that you have acquired here, and then try and get into communication, social behavior change communication, SBCC kind of organizations. You create all those information, education, communication, IEC materials that impacts public health and community health. Then organization, peer CSR organizations. We recently released a report by doing some meta-analysis of different data that is available on CSR spending, and we found out that the highest CSR spend is happening in public health, in healthcare only, right? So this is 2022 data where there was approximately 7,500 rupees in one financial year in healthcare only. I think the recent has the change. I think education has taken over the healthcare spend less. That 35% of the total spending pie. That's one area, and then of course you have options of monitoring, evaluation, other kind of organization where you can look, explore. Then the recent I was to Dr. Harsh, and I think he looks to technology-based health solutions. So most of the they have their innovation labs. So that's one area that one can is now think of. And if you think that you're tech savvy, you are artificial intelligence or other technology related stuff, so that married with your public, you can explore that area also. So these some of the things that you can explore. If you are interested in research, perhaps there are two broad I would buckets of research in the social development sector. One, if you want to do pure health-based research, there are pure health research organizations. One of these is your own college. You have PHFI, you have NIN, etc., where you go and work as research associates and do specialized health-based research. And then the other is our kind of organization where we work on multiple thematic areas. However, the biggest body of work in our organization is on public health. I mean, I think 40% of our work is public health-based research only. Besides, we also work in other areas like nutrition, water sanitation, hygiene, climate change, intersectionality issues like gender rights, etc. The beauty and good thing about exploring opportunities in these kinds of organizations is that health is not just my own physical body. I mean, there's a lot of extrinsic factors that affects my health or my physical body. The environment, the climate change affects my health, gender inequity, access to healthcare, nutritional status. So these are all those determinants of social determinants of health which are really important. And working with our kind of organization gives you that exposure, and you understand the areas also which eventually affect any individual's physical health, right? So I think I must have completed 7-8 minutes, so I'll try to wrap up. Before I conclude, I live, I would want to live with such that, the need for public health professionals today in the world is much, much more than ever because of the climate change, the looming threats of pandemic, the health inequity, etc. And therefore, your role is very critical and pivotal. And of course, I mean, there'll be a lot of challenges, etc., that would be coming along the way. But I mean, that's with any profession that you choose. All you need to do is just take a pause, reflect, and see what is working, what is not working, and then laugh at it. And then if you're not learning, if you're not laughing along the way while performing any job, you're not doing it right. So um, people, go out, be bold, be curious, be compassionate, be empathetic, because at the heart of public health is the desire to serve, the desire to heal, desire to uplift the community. So, thank you all for the patient listening, and I wish you all the best for your future. Thank you very much.
Thank you, Paresh Kumar, for sharing, 3 pillars of career, and also, sharing career of healthcare domain. So thank you so much for that. Now I invite Dr. Hardik Shah to share his insights about hospital administration. Thank you.
Good morning. Good morning. Yes, yes. Thank you. Thank you for inviting and giving this opportunity. And I must congratulate IIPH Gandhinagar for organizing such a wonderful talk on the career. Because after all, passing your course and curriculum, the end is earning a bread and butter. So it's all about the career. So pertaining to the hospital, I belong to the hospital industry. I manage the hospital and I work with various hospitals from size to large size across the Gujarat. Pertaining to the hospital, definitely there is a bright scope opportunity for the hospitals pertaining to the hospital management and hospital administration. See, the reason, trend and era in the hospitals. Previously, if we say before 10 years, 15 years, there were small clinic, nursing homes, and few hospitals and government setups. But the presently era, within 5 years, that what we are, there are nothing coming out. Gradually, they are reducing. Practitioners available in the market. Era trend to the corporatization, the hospital range from the thousands, like anything, multiple corporate coming into the society. At the same time, multiple other which are care system. Doctors are treated as doctor professionals. Doctors are treated as the employee, the full-time employee. So, based on my experience, based on my exposure, I can say that to manage the 50% of the housekeeping or security or nurses, the group of 50%, you need one manager efficiently lead the show of 50%. But to manage 50 doctors, the doctors, you need at least 5-6 coordinator, clinical coordinator, manager, NCU, and blah blah blah. So there is a huge demand for the healthcare leaders and healthcare administrators in the society. At the same time, the era is changing from the perspective. Now, patients, majority of the patients are covered under yojanas, insurance, corporate, CGHS, ESIS, multiple benefits are there. Plus, affordability of the each individual has been increased. The patients are ready to pay. Patients are spending, and against that penny of spend, they are having an expectation for the quality of care with the good hospitality. Here, the role of the good administrator come. Coming to the other sectors, that if we have seen healthcare in country, US is spending near about 18 to 20% of their GDP in their healthcare, and after spending a huge chunk, they are able to achieve 30 to 34% of the satisfaction ratio in US. At the same time, the country like Germany, Switzerland, Saudi Arabia, they are spending half of the GDP, means half of the US GDP that they are spending near about 9 to 10%, and they are able to achieve satisfaction ratio of 80 to 85%. So here, the good administration, good leadership can make wonders. And yes, uh, Dr. Anuj rightly said, there is a need of change, there is a need of transformation, there is a need of innovation in healthcare. But yes, lastly, अगर अच्छा administrator या अच्छा leader बनना है, you need to be quality, to have a good listening skill, problem solving approach. Because जब भी आप अपनी ऑफिस में बैसोगे, either as a quality manager, as a clinical coordinator, clinical administrator, CEO, whatever designation you may call in a hospital, but जब आप अपनी desk पर होगे ना, तो कोई आपको thank you बोलने नहीं आएगा. If the patient are getting benefits and good treatment, they will say thank you to the doctors, they will say thank you to the nurse, they will say thank you to the ward staff or clinical staff. But nobody will come to say thank you to you people. But हाँ, कहीं पे अगर कुछ लोचा हुआ, तो they will come with their problems. So they will always come. Each and every person coming into your office, either it might be your staff, it might be patient, relative, whosoever coming into your office, they come with their problems and they expect the solution from you. So you need to have that problem solving skill. I think session within 5 or 6 minutes. That's all from my side. If you have any queries and questions, any concerns for your scopes in the hospital, then feel free to ask.
Thank you very much, Dr. Hunter, for giving insights on and reassuring that there is a demand of hospital administrators as well as health leaders. And very importantly, he highlighted the need for patient-centered care, understanding patients' expectations in the healthcare sector. So thank you very much for your insightful experience sharing. Now I invite Dr. Ridhima Kamal, who is co-founder of Public Health Professional Solutions for Global Impact.
Hello, everyone. And when you speak in front of public, it's difficult. But when you speak in front of your friends and juniors, it gets even more difficult. So it's an honor to be here, but I'm nervous too. I am a storyteller. I think my juniors and people who have studied with me in my graduation days, they know that. And I do not tell the story of random people. I tell the stories of public health professionals. If 2 years ago, if I would have imagined myself, I would not have imagined myself standing here and talking to you about it, talking to about any organization that we have. But then there was an absolute need of it. Public Health Professionals Coalition for Global Impact, where we say that public health is just not a profession, it's a lifestyle. So when I stand here, I do not represent any specific cause, any specific division, but I represent the entire public health professionals clan who are change makers, but still looking for an opportunity to talk about. When you talk about being a public health, what do you exactly look at? What are your skill sets? What do you think? Your degree? Your qualification? Numbers of experience? Numbers of published? What not? Anything else that you would want to add on to it? Same story, sir. What do we do? As a public health professional, what exactly talk about being a layman? We travel, we plan, we carry, what not? These are not scientific terms that I'm using. Because when we stand in front of students, they have the basic why we are here in this field. The basic things that we do, right? If you have to explain this to your parents, how do you define it? This. I get to travel a lot, I get to work a lot, I get to network a lot, I get to meet a lot of people, I get to know a lot of opportunities. That's what. And I think that's what we have been doing since we have opted for masters, be it in public health or in a hospital administration. So we are a dynamic community. We do not call ourselves as a company or in any specific association. We are a dynamic community. dedicated to addressing public health challenges, innovative solutions, and evidence-based approaches. And our mission has always been to bridge the gap between public health information experts and the broader community. I would also be giving an example, couple of examples in my further slides where you would understand why this need came in picture. This key need came in picture, so no offense, but I was rejected in all these organizations when I was applying for my jobs. And that's when I realized that where am I failing? As an individual, where am I failing? Was it my qualification? No. Was it my expertise? No. But skill sets. My lack of resources. My lack of referrals, I did not know who to connect with, who to talk to. Do you know that? How many of you have learned to use LinkedIn? Thank you so much for sending me a lot of LinkedIn requests and sending me messages. Ma'am, we are excited to see you. But that made me very nervous. But are you sure that you know how to use LinkedIn? What do you do on LinkedIn? Go to LinkedIn, go to a specific organization, look for the people, associated people. You send, request send, request send, request send. Do you ever think that sending a request does not help your purpose till you send a message to them? Did you understand the fact that you have to learn to write those messages too? How many of you get offended that when you are asked to do cold emailing? Why would I do that? Why should I do that? I did. I was extremely, a little bit hesitant about it. But when there was a scarcity, I had to do it because I had no choice. So 2 years down the lane, we formed PHPCG, which is now incubated under Sushruta MedTech Innovation Lab and Enabler and Arogya Seva. We started as a WhatsApp community in 2022, and I know most of you are added here, so I can see those faces and the names as well. If any one of you are not added in the WhatsApp community yet, you can just scan it. QR code is on your screen. We started with a 45 college students group where we were just posting opportunities for ourselves. Now we have reached around 2,000 members on our WhatsApp group, which does not make me proud. I repeat, which does not make me proud. There is a need, and that's why we are here. Who would help? We would. We would help ourselves. Yeah, we had similar challenges, and I would not like to emphasize on these challenges because you could read it, reflect on it, resonate with it. Definitely, we had limited connections. I did not know what to specify. My colleagues did not know what to specify. We had financial challenges. Of course, we have a family to run. We have a house to look after. Then definitely, we did not know how to promote ourselves and upgrade because we did not know what courses and skill sets we need. Then there were frustration, of course, at the end of the day. And we did not know what latest trends are. I would like to play this so that you will understand what cold emailing meant to me. This is what I did right after completing my post-graduation. And you would see the similar subject everywhere. Request for seeking job opportunities. And people who are actually ashamed of doing it, I landed up in my first job through a cold email. 2 years down the lane, I'm still in that same organization. Don't be ashamed of network. Don't. You never know where you end up with. So, I mean, I really wanted to show you all so that you understand the kind of challenges and issues, struggles that we face. So what we do? So we act as a centralized hub for resources, bringing down public health information, technological innovations, and professional expertise. And when we talk about professional expertise, it could be someone who is having at least 2 years of experience to having as many numbers of experience as he can. And I think Career Talk got a little delayed because I reached the podium a little late because I was talking to one of your juniors and I realized that, oh, I don't know this. And I have to learn from one of you that these are the new challenges, these are the new changes you are facing as a new public health professional. So I had to modify my presentation a bit. And yes, we are promoting sustainable best practices, preventing measures and reduce long-term healthcare costs and improve quality of life. I already talked about it, so we have time constraint. Our initiatives, we are in social collaborations, where we collaborate with public health enthusiasts. We provide career guidance, and we do the tailored career guidance to all the students. The only fact is you have to reach out to us. We don't know what help you need. And we do awareness events in and across the country. So we started with Bangalore, and then now we have expanding to almost all the cities, and we are starting the state chapters. We have been doing a lot of webinars where we provide opportunities for learning, discussing skill development. And we are, in the month of February, we are doing a residential workshop for public health professionals where you all are most welcome. We will be declaring the location for the same. These are our beneficiaries. So public health professional, all of you. Medical professionals, again, all of you. Mentors and leaders, you would be. Healthcare organizations, your organizations, all the other organizations who are here. Educational institutions, we are standing in educational institution. Investors, maybe you would come across them in a couple of months or maybe years, but you would have to face them. Government agencies and business ecosystem partners. This is just a glimpse of an event that we did last month. And all of these are MPH students. For your kind information, all of them are the pursuing MPH students from Delhi NCR. And all of them had the same question: how do we get to know each other? How do we get to know other students as well? We did a public health professional mixture. It was one of the first public health professional mixture in India. It will happen in Bangalore in October. So let's talk about the latest trends. What new? What new you think you can get in public health? You can explore your career fields in digital health and telemedicine. You can focus on mental health, and because it has been very, very prevalent these days and very important for all of us. Climate change and health, I have heard someone said that she's interested in being in an environment, she wants to be an environmentalist. And I know people who are looking for internships in environment as well. So I have also mentioned a few of the organizations who provide internships over there. If you have any issues and if you need any referral you need, you can just reach out to me. I'll be putting the contact in my further slides. Yeah. Networking. I will just pause here for like 1 minute and I will just ask two people, why is networking important? And how do you define networking?
Anyone want to answer?
Yes, please. I know.
For me, network is something that helps me to connect with the people to whom I want to work with, to whom I want to explore, experience, and to make my career on a more specific and a straight direction where I want to walk on.
Thank you. That's a lovely, lovely definition of networking. Anyone else? Yes, just one. Yeah.
It's a process of sharing information. It's a first step for the sharing of information between anyone, the seniors, the juniors. You can learn from anyone, I think.
And do you think if you network very well, you can also be benefiting someone? And just not you getting benefits from someone?
Yes.
Your expertise will help. You will be appreciated enough. So that's why we need to network. Share knowledge, collaborate for common goals as much as you can. Mobilize resources, strengthen community impact, and that's what we have been emphasizing on NPHPCG. Referral, because referral is still a very new concept in public health. It's very prevalent everywhere else, but for us, it's very, very new. So we have been trying to provide referrals to our close network and connect with current and past employees. You will see some of the testimonials in my last slides. So just, I mean, if you're thinking, oh, how are you going to do it? We have already done it. So we will also be sending you the information about the conferences, webinars, symposiums, and also will tell you how to send cold emails to people you want to work with, or maybe you want to hire people, if you do. This is the QR code for people who would want to join PHPCG. So you can just scan it, and because I have only 2 minutes, so we'll have to skip a few slides. And we have something with some few components for every one of you. These are career paths you can choose, but the world won't mind if you just develop something of your interest, because that's what public health all about. So this is how we are helping. We are providing a network of external mentors. We provide you awareness and to connect with relevant innovators. We have partnered with academia, government, and funding agencies. And of course, you own the responsibility for own your project, so you are a leader of your own. So maybe you can discuss about Sushruta with me in the lunchtime. These are our future plans, because we have already started our Delhi and Bangalore chapter. And we are also doing a job fair, because in coming months, for public health professionals, which you all are most welcomed of. And we are doing structured internships. Meet our best team, but we're still looking for the third partner, which could be you and all of you. So this is the MPH Accelerator Joint Internship Program for MPH students. So if any one of you are interested, you can send us your CVs, and we will be providing you tailored internships for the same. I'll just end this with this.
I'm Dr. Sutirna Chaudhary, a dentist and public health specialist. I'm here to express my sincere gratitude towards the Public Health Professionals Coalition for Global Impact, and primarily Dr. Ridhima Kamal, for creating such an efficient space for us public health professionals. I landed my very first job from this very coalition, and I'm currently working as a monitoring and evaluation officer at an NGO in Jharkhand, and I'm highly satisfied with my job. The group has helped me dive into the various opportunities of public health, both on the surface as well as those dug deeply. I really hope that the association continues to grow and the coalition itself accelerates in its initiative of getting together all public professionals of India and guiding them well in their careers so that we get placed at wonderful organizations in our future.
Thank you so much from my end. I am around. If any questions, you just feel free to reach out to me. Thank you so much.
Yeah. Thank you, Ridhima, for providing your experience and giving an example how failures can be converted into opportunities of creating an enterprise, which is very unique. Helping others get a good job is also very important profession. And also she mentioned about career paths and art of networking. So thank you for providing your insights. Now I request and invite Dr. Rohan Desai, who is also an example of, creating opportunities for others and self.
Hi, good morning. Thank you, sir, for inviting me. I think the organizing team has done a great job in the diversity of the panel. I think you've covered a lot of different areas of healthcare and careers. So I'll be speaking about my experience in building a EdTech platform for doctors. I'll start with a very brief background about me because I wanted to share some thoughts on how to think about your career, and I'll just use my story as the context. So I did my MBBS from NHL in 2008, and I did my MBA after that. won't get into that right now. Why MBA after MBBS? All of you are, I think, in the same boat. I think our answers are mostly aligned. After MBA, I went to a healthcare consulting firm and spent 4 or 5 years there. After which I founded Plexus MD, which became Netflix during the COVID time. And yeah, so that was more about the CV. And a few, things which are not on the CV typically. Like I had doctor parents, which led to the first bullet point there, which is MBBS. And I was always, in love with tech as a kid. So we got a PC very, very early, something which is, a given now. But growing up, having a PC was quite, rare. So fortunate to have that early on. I used to hack, when I was in 6th, 7th standard, and this was 96, 97. So it's like way before things became common. I learned web designing in 7th, 8th standard, self-taught. All these coffee cup, HTML editor, and all of these things were there. I hosted a very, very lame website when I was a kid. So just goes to say that being a tech hobbyist, I am myself amazed I know the science after all of this. I've also been like a teacher, so I enjoy teaching. So it started with my sister as my guinea pig, but then her friends joined in, and then my friends. I've generally taught two things. I've taught maths a lot, taught German language. So yeah, I've been a teacher, and back in was if you know, then we are close by. But yeah, there used to be Orkut, and I used to run a popular community on Orkut, knowledge and teaching. So the reason I shared this is now if you look at these, I've just color coded them, being a little nerdy there. But yeah, so this happens in retrospect. You don't know this while you're on the journey, but if you look back at the last 20, 30 years, things fall in three circles for me. These are three things I've been very passionate about: healthcare, technology, and education. And so yeah, all those points fall somewhere there, and which is where Netflix is. So the point is, try to keep looking for things which you are both good at and enjoy. I think this combination is very important. And once you find that, double down on that, and try to spend all your life there. Work won't feel like work if you're doing something that you're good at and you enjoy. So some reflections, and the first one is what I shared, like find your sweet spot. This is not very, this does not happen, you can't force it to happen. This will happen, this will be retrospective, but I mean, just keep thinking about it. Play to your strengths. I think there's enough, all appraisals start with areas of improvement and what I could get better at. But there is a whole philosophy. There's a book called Strength Finder, and there's a whole philosophy which basically says double down on your strengths. No, everyone will have weaknesses. My language is poor, my diction is poor, forget it. Talk about what I'm good at and just double down on that. So keep that, because that feeds back into the first point of doing what you're good at. So whatever you're good at, keep getting better at it, keep getting better at it as much as you can. For me, this is one thing which has always helped, and I think it's very underrated. Go on long walks. When I was in IMA and we had to sit for summer internships, and there were some organizations which had very painful processes. They would have like four, 5, 6 page long forms to be filled, and they ask very profound questions. What is your purpose in life, and things like that. I think what really helped me was going on very long walks, just alone, not writing, not noting, just thinking. Because I think in our current life, we don't spend enough time thinking or with ourselves. So whenever, take time out and reflect and just think. Don't worry about noting it down. You could come back and note it down somewhere, but it just surfaces things which are buried deep inside you and brings them on the top. optimize for passion, I would say. Almost all careers are very long journeys. And if you'll optimize for passion, you'll not find yourself asking yourself every week or every appraisal cycle, ki what am I doing? Am I in the right place? Am I stagnating? Also because most journeys are not like straight line slopes. They're very, very, very ups and downs. So especially when things are not going great, it could be macroeconomic things, the economy is bad. It could be organizational things. It could be personal things. Personally, you're having a really bad time. If you're following something which you're passionate about, I think that'll hold you through all of those downs. Don't do things which your friends are passionate about. Don't do things which seem to be cool, seem to be exciting, seem to be the future. Just do things which you are passionate about. It really helps you in those difficult times. And there are so many difficult times. As I said, it could be economy-led difficult times. Like there is the organization is laying off 30% people. It's no fault of yours, and so on. There is a book I strongly recommend, and many of you might have actually heard and read it. It's a very small book called The Almanac of Naval Ravikant. Naval Ravikant is a investor, but the book is like, it could become a Bible of sorts for your life. And one of the things that he emphasizes a lot in that, which a lot of us also intuitively understand, but it's just a good way to put it, that if you're given two choices at any point, like choosing a job, choosing a post-graduation, choosing between two jobs, anything, like whenever you have two choices, take the one where there is more short-term pain, and which means take the tougher one. Take the one which seems difficult or more painful or less beneficial in the short term, because everything has a consequence, everything has a cost to it. If you'll take the short-term gain route, then you'll pay for it in the long run. And simple examples are, going to the gym, going for a walk. You have to cut on your sleep. You have to wake up. You have to waste 1 hour. Take that short-term pain. In the long run, it will really, really, really take you far. But if you will optimize for short-term pleasure, which could be in the form of a good salary, but with an organization you don't sync with, or career you don't belong to, you'll have a decent early salary. You keep growing that. There are jumpers, and you jump every 2 years and get a nice 20% increment, 30% increment. But 10 years, 15 years, there will be a midlife crisis, and you might actually feel where reached or where. This is a great mental model. Maximize on short-term pain. Choose which gives you short-term pain, because your brain isn't wired to do that. Your brain is wired to maximize on pleasure. So your default is always short-term pleasure. And so, this is an important thing when you think of your career. Sorry for the time. Most of us are Thala fans and Dhoni fans, and I think we can this last sentence. Not when you're speaking here, and I don't think I have more time than I think right now. But in general, you have more time than you think in life. I think we really rush things, and we really overestimate urgency. As a founder, when I Lexus MD and one of our competitors raised $2 million, and I was worried. I was so worried. Next morning, I couldn't wake up. And I was worried that competitor would basically have put out a huge ad on the front page of Times of India because they have raised $2 million. All the users will go there. For the next 18 months, nothing happened. Nothing at all with that $2 million for them. So I think we overestimate things, the power of money, the power of time. You have a lot of time. Don't try to rush things. So take the game in the last, and then more often than not win it for you in his prime. Take your time. I just put this article, this today's Times of India, and very, very interesting title there. Can we be the first generation that doesn't die? And this is coming from, I don't know this guy. He might be real, he might be, I don't know about him. But there's been a lot of talk about research and creating, so this combination of nano robotics, which is basically, nano means just shrinking the technology, and robotics is, so they're trying to create molecules which are injected in your body, and this exist. Thesis is that we'll create molecules, robots, like very, very microscopic robots, which in your, and around repairing things which are not fine. So they will go to the kidney, right, the heart cells, right, and this is essentially to extend the lifespan. Now, immortality is not going to happen overnight. If your expected life socioeconomic status is, let's say, 80 years, advances in, kind of things can take to 90 or 100, which gives you another more R&D, and so on and so forth. So, I mean, it's a real sort of a possibility which cannot be written off, that people will extend lifespans like crazy. Now, think about it. You rush your life right now and you take decisions thinking, I don't have time, I don't have time. What if you have time? You're making all the bad decisions. So, you always have more time than you think. How much time do I have right now? 3 minutes. So, we'll leave the second and third part of this. I thought I'll cover three things, which was being really ambitious anyway. I'll just talk about how to start up and leave the other two parts for today some other time. So, my journey of entrepreneurship started in 2014. It probably started a lot before that, because I kept thinking of what could we build from a very early age. But I wanted to talk about how to start up, because for a lot of people who somewhere think of entrepreneurship as a possibility, it's not necessary that you start something tomorrow. You might want to get off to a good job, get some experience, pay off some loans, but it might be in your mind, I want to start up after 5 years or 7 years. So even at that stage, there are many reasons people don't start up. Fear of failure will be right up there. Financial question marks will be right up there. So these are some of the typical reasons why people don't start up. But the number one reason why people don't start up is probably they don't know what to build. And I thought I'll just give you a very simple way to think about it. If you're all ready, like, financial is not a problem, is not a problem, fear of failure is not a problem, family support is not a problem, you're all ready to start up, but you don't know what to do, like what to build. It seems like every good idea is taken. Uber is taken, Zomato is taken, what should I build? So I think the simple approach to this is to find a very large problem. What to build starts with knowing a very, very large problem that exists. Be just around your world, look at yourself, look at your daily life, look at your parents' daily life, look at your kids' daily life, whatever. Think about problems in the world, think about friction in the world, think about inefficiencies, and then start thinking about it. The next stage is to figure out a solution to that, obviously. But the problem is the starting point, always. So for anyone here who's at some point, just open up yourself to problems now. Everything should look to you like a problem which need to be solved. Figure out a hypothetical solution, go back, speak with some friends, test your solution, put some numbers on Excel, ki, acha, how much money might it take to build this? How much money could a user pay for this? Just get into that habit of problem solving this. And maybe with your 50th idea or 70th idea, you might be ready to take the jump. So find a significant problem, identify a potential solution. Now solutions generally fall in couple of categories. Either you're trying to solve something which is unsolved today. So either you're trying to solve something which doesn't exist today, like what Elon Musk does. Most of his things he's trying to do things which can't happen. Like, people who are deaf, mute, or paralyzed can't operate a computer, and he's trying to do that. So that's one category. That's like massive. But a lot of entrepreneurship happens in the second category, where you basically make things 10x better or 10x faster or 10x cheaper. This is where all your Zomatos and Ubers and most of your startups will fall in this category. So think of things and think how you could make these things 10x faster or 10x cheaper. And this is where your solution has to tick these boxes. Because if you're not 10x cheaper or if you're not 10x faster or better, it'll be very, very difficult for you to take that to market. Because 20% faster, 20% cheaper is a Reliance game or a large organization game. It's not your game. You can't say that, look, this is a problem. Uber gives me this ride for 400 rupees, I'll give it for 360. It's very difficult to fight with Uber and Ola now. But if you can do it for 40 rupees, that's when you need to start thinking about it. So that's where the innovation has to happen. So I'll just end, just a couple of more slides. Once you have a problem and solution in mind, there are a few questions you need to ask. Is there a sizable market? Just think about these questions. Try to answer these questions. You have the training, and if there is some missing training, there are so many things available on Coursera and YouTube. Put this sentence on YouTube, is how to do market sizing for an idea I have. You'll obviously find good things, right? So is there a sizable market? Will anyone pay? How much will they pay? Can it make money? And why me? Like, why should I do this? Is there some story? Is there a reason why I need to do this? Because if there is a reason, it becomes very, very easy for you to pull that journey. The journey is a 30-year journey, which is why I'll go back to my intersection. If I think about Netflix and Plexus MD, and if I try to answer this question, me, because I love healthcare, because I love education, because I love technology, so it makes me very suitable to build this platform. It makes me very resourceful to build this platform, and this is a very, very long journey. It will give me enough energy and kinetic momentum to run through the whole period that's required. Finally, jump and build and launch your minimum viable product. Do something prototype. Do a small thing. Don't build the whole thing. Build a shadow product. Pilot it with a few people. And the rest of the points are for a later conversation. Like, do you bootstrap? Do you raise funds? All of that is for a later conversation. So yeah, I think I'll end there. And thank you so much for giving me this stage. And I'm around.
Thank you, Dr. Rohan. I think he has set an example of how hobbies can be converted into passion and how passion becomes profession by building enterprise. So thank you very much. Now I invite Dr. Swagat Shah to deliver his talk.
Thank you IIPH for giving me this wonderful opportunity and to share the dais with such a big celebrities. I've always shared the dais with other orthopedic surgeons and they are discussing about that whether this tendon is important for my ligament surgery or that tendon is important. And in knee replacement, what are the pain parameters, and we have always discussed such things on stage. So frankly, I'm first time I'm speaking on any other topics apart from orthopedics and education, and that is about career opportunities in hospital management. So first, when Dr. Mehta had called me that you are supposed to take the lecture on career opportunities, then I had asked frankly, students are there? Because why I always talk about medical career, that no, all the students would be from different fields, and how many students are there who are from medical? Yes, and how many are changing the non-medical background to medical background? So there are most of the students who are from background and those who are seeking opportunities in healthcare industry. Healthcare industry is a industry. So if we are seeing that institutes and lectures, conferences are happening only since last. Those lectures not here or such institutes not there because there was no need, or either there was no need of an hour in before 30-40 years, because the hospitals were small nursing homes and doctors were running it single-handedly, and Hardik mentioned that few government hospitals. So people used to accept the complications and there were no medical legal cases on hospitals and there was so much of acceptance. But with the time, with the globalization, healthcare industry is under now a lot of we are seeing in the newspaper media nowadays as well. And there are many faults at every stage. It is not the fault of one person or one institute, but it is fault at multiple levels. It might be at management level, it might be at the strategy levels, it might be at the program levels, and it might be at the patient levels. So, keeping all that aside, hi, Dr. Sagar, I'm consultant orthopedic surgeon and owner and director at DHS Multi-Specialty Hospital, and it's a twin tower multi-specialty hospital in Vastrapur Lake in Ahmedabad. And so first, I would like to take in hospital, what can be the different job opportunities or what can be the different departments in hospital. So one is patient centric. So in that there would be doctors and nurses and attendants. So these departments are there in all small hospitals. But when hospitals starting to grow or expand, they need support services and they need administrative departments. So in mid-scale hospitals, they need pharmacy, laboratory, imaging, nutrition or rehab, physiotherapy, and little bit of administrative departments. Like there would be one hospital administrator, one marketing person. And when hospitals become really big or corporate hospitals, so the biggest difference between other hospital and corporate hospital is administrative departments for smooth operations covering HR, finance, marketing, legal aspects, and there are so many things. So here I have penned down the different departments in the hospital where management people come to play the role. So first is the administration and patient services, patient care services. So there might be different names in different hospitals or there might be different culture, but mainly hospital administrators, operations manager, facility manager, business development manager, quality officer, HR manager, finance manager, patient relationship manager, front desk executive, customer care executive, billing executives, and n number of it. Then comes the information and technology related, like IT manager, health informative specialist, data analyst, marketing and PR related, marketing manager, brand manager, social media coordinator, corporate liaison officer, supply chain procurement related, there will be finance and accounts related, research and training related, and hospitality service related. And that is really a booming industry or booming vertical in any corporate hospital because of scopes in medical tourism and international patient management. So what does hospital administration mean? Basically, if the doctor is running the hospital, then who will do the administration? So there lies the role of hospital administrators. So in any good industries, either doctor is not practicing, then and then hospital can become big, or the hospital administration posts have to be there. So in hospital administrator, there might be business development manager, operation manager, and like that. So what are the roles and responsibilities of these hospital administrators? So main responsibilities are strategic planning for the future growth of the hospital, financial management, because cost, quality, and accessibility. These three are the parameters which needs to be balanced, because cost is a big factor, because acquiring this many managers and hospital administrators would definitely increase the financial load. And in most of the hospital, if you have seen the financial parts, then nowadays most of the bills of the patients are having fixed packages. Suppose for knee replacement, there are fixed packages. Even if Mediclaim is of 1 lakh rupee, 50 lakh rupees or 1 CR, the amount of one knee replacement is the same. There is no difference. So there lies the difference amongst the Western countries and Indian countries. In US, the same knee replacement would cost around 1 lakh to 150, 100,000 to 150,000, around 1.5 lakh dollars. And in India, suppose in the government scheme, we do knee replacements is 80,000 rupees. Now just compare $1,50,000, the same surgery in India, it is happening in 80,000 rupees. So there lies the financial management, human resources. That's a big problem. HR, because of the competition and constant, the staffs are going in and out, and different compliances with different boards, compliances with medical boards, and compliances with different government like fire and municipal corporations. And the skills. First and foremost skill is leadership, because if you will become leader, then and then hospital can go to the next level. So that leadership includes many aspects. Like there would be day-to-day problems, and for that problems you can't go to the medical director or the CEOs. For example, suppose if some patient is coming with half strip that I want to replace this or give it return, then there would be so many small problems. So those problems, if you are solving or you are giving the rights to solve to your next level person, then you can take that leadership to next level. Communication. There might be many day-to-day problems. For that, communication skills are very important, because in hospital the emotions are attached. Suppose if you have bought some flat with the builder, if there will be some fight there regarding the price, it will not come in any media or anywhere. But if the same thing has happened in the hospital, then it will bother us, because emotions are there. So you have to deal with empathy, problem solving, day-to-day problem solving, and decision makings. And there might be different qualifications like masters in healthcare administrations, experience in hospital and understanding of healthcare regulations. There are quality officers for accreditation and standards like NABH, it is the National Accreditation Board of Hospital, and JCI. So this is the ultimate standard for the care of the hospital. So wherever you are working or wherever you want to work, make sure either that hospital is NABH or JCI accredited, or you make that hospital NABH accredited. So there comes the role of quality officer. So quality officer mainly looks after patient safety, all the compliances. It is the continuous improvement, because day in day out there would be so many different compliances would come, or new parameters. Earlier you were taking care at this level, but now you have to take this much amount of care, and there would be so many objective parameters for performance measurements. Then come patient care services related departments, where relationship manager, medical record officer, help desk coordinator, front desk executive, customer care, billing executives, this all part also comes under management related things. Either you have to go through these roles, or you must know from basics that what are the roles of a billing manager, what he is supposed to do. Then and then you can take that leadership of that post. And advancement opportunities in hospital leadership. There would be entry-level roles, just I said, like gain experience in operations, administrations, quality management. Then comes the supervisory positions. You can take the supervision of these basic roles. And then you can lead to the management level roles, where you can take the leadership responsibilities, you can oversee the budgets and make the strategic decisions, and you can guide the doctors, because doctors would be working under you if you are at management roles. Then handling those doctors is really a big task. And developing specialized skills and expertise. You need a formal education degrees like what IIPH is providing. There would be different certifications, and at each and every level, after each and every few months or years, you need to advance your knowledge, and you can attend the conferences, workshops, seminars, and you need to challenge. There are many challenges in healthcare industries. Like first I told you, the cost is a big challenge. Handling workforce is a big challenge. Then technology is rapidly changing, rapidly advancing. Then those are, you have to tackle those challenges as well. And there might be crises like COVID crisis. We had opened our hospital in 2019 second half, and the COVID hit, And we were one of the first hospital who was converted into COVID hospital, because we realized the global situation, that anyway COVID is going to come to India. It was a lockdown situation. There were very few cases of COVID, but we belong to a surgical industry where most of these are planned surgery. Then we going to deal with knee replacement lockdown, but we need to change the hospital to COVID hospital. And so there might be such crisis, and at that time leadership comes where you have not faced such situations, and role of technology, because like electronic health records, like AI is coming, and take into your institute is a big advantage. So next steps for your career would be gain relevant experience through internships, volunteer work, any part-time jobs. You network with your professionals, as Dr. Ridhima told, that networking is very important. Attend industry events, connect on LinkedIn, seek mentors, and apply whichever open positions are there. Don't get afraid or get ashamed of applying. Apply करशो तो मरसे job, नहीं करो तो nothing. Try applying for all open positions, research hospital, target specific roles, because there might be hospitals seeking for the same role as what you are searching, but because you had not applied, you did not get the job, or hospital get opportunity. Yes. Lastly, the best way to predict the future is to create it. Yes, thank you. And you can connect me on LinkedIn or connect me on Facebook, Instagram, wherever. I'm available everywhere. Yes, thank you.
Thank you very much for providing insights on in hospital important area. So I really once again thank all panelists and experts who have shared their experiences and important insights on career. And I would like to, summarize them. Just a quick attempt to summarize so that we can just take away 2 points for our career. First of all, we learn about different opportunities in Indian Air Force for healthcare professionals, and I believe few of you may want to apply and learn out of all experts spoke is that health is not a profession. It is important, of living. It's a lifestyle. And we also learn that, is not what you do, it is a learning process. It's a continuous learning process. Leadership doesn't come with designation. It comes with what you do in your capacities. So these are important can take. So, what I have tried to understand and comprehend from these experts that, graduation can give you degree. Graduation can give you degree, but skills and competencies give you a career. So is your responsibility. So degree can give, educational institutions can give you degree, and the career that you need to build, and you need to take ownership of taking job or challenging job rather than taking up, easy job and cozy job. And, the importance of self-assessment, career assessment, self-reflection has been, emphasized by many speakers here. So it's very important to reflect on our own skills, reflect on our own passion, our goals, and at the same time, taking care of self-care. Sir has given example of walking. So it is important to take care of ourselves, spending some time with self, at the same time pursue our, our career. And last point which I would like to highlight, that how we all are going to face failure. So how failures can be turned into opportunities. And one person who is looking for a job can become job creators. And we are here, we are having these people who once upon a time skill job, and now they are offering jobs. So with this, I would like to, hand over this mic to my moderator, Ajay, to open.
Thank you all for such an Is now for question open for question answer. We have 5 odds minutes. We'll take few questions. Yes.
Yeah, there is someone.
Hello, sir. My question is to myself, Dr. Saguna Parmar, HMS graduate. As I am from clinical break, I have worked for more than 5 years in hospital industry as a medical officer. Now, so I know a bit about how hospital setup works. So my future goal is to work in hospital. But if only for a learning purpose, if I say if I want to explore other industries like health consultancy or any consultancy or pharmacy industries, or like, is it okay to do so, or it will be a time pass, or it will be a waste of time for me? Please suggest.
See, as you said that you have done your bachelor in homeopathy and your hospital management. In the what I have explored, the profile is similar for the insurance and hospital. I was looking after the provider management department, network hospital. I was supposed to visit a hospital. I'm supposed to hospital infrastructure assessment side. We are making a tie-up of that particular hospital with particular insurance company. And last 16 years I'm working in hospital in different perspective. I personally believe and to go to hospitals because the hospitals are growing, numbers of new hospitals are coming up, and multiple venues in the hospitals, as Dr. Swagar rightly says, quality, administration, clinical coordinations, C administrator, multiple variations are available within the hospitals. In future goal, the hospitals are the better way to enhance your career. That is my personal opinion. Dr. Swagar?
Would like for little, because if you are not satisfied, or if this is not your dream, then you can search. If 6 months or 1 year is lost in life, it would not be a big loss in your career, frankly. As Dr. Rohan said, his parents were doctors. Well, but he made something different out of it. My father is architect, and I kept architecture. I did my over there, but I realized that this is not my dream, because when I was child then, and I always architect banenge, architect banenge. But when I went to there, I realized no, this is not my dream. I मुझे नहीं दिख रहा है मेरा फ्यूचर इसमें. To engineering, I went. Everyone was taking. Started my. Then I realized no, this is also not my. Then I came to a medical, and after medical, I was searching which is the technical branch. I went to orthopedics, and then I realized that leadership is something that quality in me which is even bigger than my orthopedic degree. And so I took that opportunity, and we started this and so on. So it is not only one thing which you have taken BHMS degree, that is pretty good, but you can now invest that degree's knowledge and you can pursue a career. But frankly, medical related, anything you are interested, you can take it. That would be my personal advice.
Greetings to the wonderful panel. I'm Dr. Banda, pursuing my MPH at IPAG here. So I believe that in every saturated job sector, there are always some gaps that are left to be fulfilled. What, according to you, are the arenas where the supply of public health professionals is not meeting the demand, so we can tailor ourselves accordingly?
Dr. Anoop, if you can.
Yes. So, I don't know. Health training, but been handling public health professionals for the better part of a decade now by virtue of my association with organizations. Started as a professional related to um, getting on board talent, managing talent, and developing talent in this particular domain that we look at, is that the market is heavily skewed in terms of demand and supply. And when I say demand and supply, it is not a lack of public health professionals. When I say demand and supply, it is the lack of public health professionals in which there is a need for public health professionals. Yeah, because even now when I look at public health, I don't know, there are subject matter experts here, but public health is very much a government-driven enterprise still. Yeah, a lot of us in the urban and semi-urban setups haven't even set foot inside a government hospital. For the life of me, the first time I set foot inside a government hospital was when I was 33, growing up in Ahmedabad. Yeah, so ये एक challenge है. So I remember the first time when I came into this particular campus, 2019, I was with CARE, working for the Bill and Melinda Gates Foundation project, public health infrastructure strengthening in Bihar, Jharkhand, and UP. And I asked a simple question: how many of you want to go to Bihar and Jharkhand and start working there in public health? You're public health professionals. That gave me a lot of perspective. So I will ask the same question to you. You want to be working in public health, but do you want to be working in Delhi, Mumbai, Ahmedabad, Bangalore, Hyderabad, or Kolkata? Or you want to be working in Muzaffarpur, or you want to be working in Gorakhpur, and all these places where there is an actual need for public health infrastructure strengthening? So maybe you can read up a little bit more on that. So that is the challenge, and not the lack of people trained as public health professionals. That's how I look at it. Yeah.
Thank you, sir.
We'll take two more.
Hello, sir. MPH. So, my question is regarding the switching of the job. So, in IT sector, we find that like people do switch their jobs multiple times. So, is it good in our sector as well, like in the healthcare sector or the public health sector?
Sorry, sir.
Great question. Simple answer. I think Rohan mentioned about it, and a very critical, important point, that the short-term pains you should look at. The initial 3 years, 5 years, work very hard, gain skills and expertise. 10 years, if you, I've seen, I've worked for about, including my own enterprise, worked for the sector. Seen a lot of people, have career travel along with me. And, people who were switching frequently, probably they were getting all those short-term gains in terms of 30%, 40% kind of increments. But, eventually what happened is that, after 15 years, they're still, they're into that kind of a system. And still have a job. They're not, sort of, I the TVs of years of, then when I ask them, basically, they don't know that because they have not stuck around. They have not, tried to acquire the right skill that was really needed. So I don't think switching is the best thing, for youngsters.
I'll just like to add a point that when you're opting for a job in public, basic pillars to that. There's like consistency, strength, and trust, and that's why you are here. And if you are not continuing to be an organization for a longer period of time, you are missing out on that part of consistency and trust. And, for my personal experience, if I would not have joined Seva back then, right after my post-graduation, I would not be sitting here. So starting as my journey as a project coordinator, working in Northeast, covering all parts of all the states of Northeast, working in Assam, Mizoram, and Meghalaya, some parts of Meghalaya, and then moving to Karnataka, Andhra Pradesh. That comes only because organization trusted me and I trusted them back. So if you want to acquire that trust and that perseverance in someone, you have to give your time and efforts to them. And success comes very slow. Success does not come with a lot of monetary values. Success comes with your moral values as well. So you have to stick to that.
Pretty sort of an input to this. Yeah, Dr. Riddhima had many pertinent questions. Now, I ask a simple question. So when I look at the frequency central, I am very much interested to know why would you want to be jumping around? Yeah, because the work that we do is a subset of the life that we live. Yeah, my journey is different from yours, and your job and the career that you have to be of your life. I don't see a harm in shifting, provided exactly what we're doing, right? So there are pros and cons to everything. Paresh is very clear कि मेरे पास CV आता है, मैं चेक करता हूँ, मुझे पता चलता है कि इसको तो कुछ आता ही नहीं, 20-25 साल हो गए. Because after 20-25 years, you sort of expect certain inputs from an individual. And Dr. Desai was very clear. I've read that book, by the way. It's seminal. Yeah, that, I mean, what gives you short-term gains may not be the right decision. So when you make a considered shift and you're convinced with your decision, you have considered all the pros and cons, yes, I see no harm. However, as an HR professional, let me tell you this, I don't look at CVs with 10 jobs in 10 years too kindly. Yes, and that's true for a lot of us who are entrusted with the task of identifying, hiring, and managing talent. So that's what it is. There's no right and wrong in this, but that's how the market behaves.
Sir, actually, I have two questions. First one is basically from Dr. Rohan Desai, sir. So, sir, as a healthcare entrepreneur, what were some of the key challenges you faced while building your organization, and how did you overcome it? And actually, second question I am having is, since I'm the placement cell, student placement cell coordinator of my batch, so I have a brief idea what my batchmates are looking onto in their future career, basically in public health as well as hospital administration. So my second question is, so how do we approach leadership, and what advice would you people give to aspiring entrepreneurs who want to build and lead a high performing team?
Some very specific challenges come industries, and I think one of the major challenges which leads to a lot of consequences is that healthcare is very small, and a lot of our issues come from there. It's what, 3% of GDP, 4% of GDP. It's so much higher in other economies. It just does not have the amount of importance or the mind share of the consumer that it should have. It's everything. Life and health is everything. It's productivity, makes you enjoy, consume things. But unfortunately, and it's not it's of the country, evolution of the country, the way we have grown. It will change over time. Problem today, it's a industry compared to other industries. So once the industry becomes bigger, boom, everybody to play and do innovation. So I think that's one challenge. Challenge, it's very fragmented because a large small industry is private and fragmented. Like everybody has their different systems, everybody has different processes. So somebody has a solution, fit into everybody's clinic, it's so hard, or to fit into everybody's workflow is very hard. Compare that with US, where Medicare and Medicaid take such a large percentage. So many HR companies, but there are 4 or 5 massive in the US. In India, there are 5,000 HR companies. So lack of interoperability is an issue, and it's also the source of innovation. It's also what allows you to do something. Because if it was as consolidated, you would have no role to play. If TCS, Mahindra in healthcare in every field, then what would? I think that's what creates the opportunity. How we have solved for it with patience. I think it takes a lot to build things in healthcare. Whether you want to build an institution, a public health foundation, anything, an academic, everything in healthcare is going to take time because the profits are there. And because the profits aren't there, the investors are the apple of their eye. The apple of their eye is consumer tech, delivery tech, transport, HR tech, all of that. Healthcare is not anybody's. Name one unicorn in India which is a healthcare company. There's nothing. There's just Pharmacy, and they were for some time a unicorn. So it's difficult in that sense, and you'll have to bootstrap, find creative ways of journey, and you'll have to give yourself more time. So I think those are some of the challenges in healthcare. What was the second question?
So how do we approach leadership to build a high-performing team, basically?
I'll let somebody else take that. So.
Challenge or maybe major that we face when we are forming a team is why as a leader you are not able to express your vision very well. And if any entrepreneur is very well able to what team, it makes things very easy. And also when we are starting out on any entrepreneurship journey, there is a source of motivation, as Dr. Rohan Desai sir also said, but still helping your team also, that motivation is very important because trends may keep changing. I'll give you a very basic example, sir. When we started, I think there was a couple of hampers which were sent to a few of the doctors in initial days, and I was one of them. And I think it was back in 2020. And I received a hamper in the very beginning days, and I still have the mobile holder. So that was the motivation, and whenever I look at that mobile holder, I think of Netflix. And that's the kind of impression it has on a clientele, it has on the consumers. And when you are able to build that relationship with your consumers, with your clients, and with your team members, your entrepreneur journey will be very, very smooth. And yes, be your own leader for yourself also. Keep yourself self-motivated, and do take feedback from your team members. That is very important because if we are only telling them that to do something, we become dictators. We do not become leaders. So that feedback mechanism, very, very important. And yeah, that's it. Anyone else?
Thank you.
Thank you. We won't be able to take questions now. Our speakers will stay back here. You can ask them question afterwards. Now I would like to invite Megha Pradhan for vote of thanks.
Good afternoon, everyone. I'm Megha Pradhan from Placement Committee. On behalf of IIG, I would like to extend heartfelt gratitude to all the speakers who have joined us from various esteemed organizations. Your diverse perspectives on career development and opportunities in public health and hospital administration have been nothing short of inspiring, given us steps to shape our professional journeys in these critical fields. I'd also like to extend my gratitude to our organization, faculty members, seriously planning and coordinating this event. To our fellow participants and participation, let us carry learnings and use them to build a area. One all wonderful. Thank you.
For the validatory function of ACES. Student needs to stay back here only.
Good afternoon, ladies and gentlemen. As we approach the conclusion of ACES 2024, it is time to celebrate the achievements and contributions that have made this event so memorable. I, Mudita Adania, Student Organizing Secretary for ACES 2024, am honored to begin the valedictory ceremony. We will now first conduct the prize distribution to honor those who have excelled and inspired us throughout this journey. I welcome our patron, Dr. Nitin Suman Shah, on stage, and our director, Dr. Deepak Saxena. Welcome, sir. A little bit about Nitin, sir. Nitin, sir, has obtained an MBBS and MD degree from Gujarat University and also a fellowship from various hospitals of London, UK. He is a preventive cardiologist, diabetologist, and philanthropist. Sir is also attached to many other organizations. He is the trustee and medical director of Blind People's Association India, vice president of National Association for the Blind India, the president of Gujarat Research Society Governing Council member, and also Arvind Lalbhai Charitable Trust. It is an honor to have you, sir. These are just a few of his associations. I now request Nitin, sir, to address the gathering before we begin.
My throat is bad, but I wish you all student. And one thing I want to declare, yesterday I think 34 students met me, and really by heart they have requested me that they need some vehicle for going out or get to our campus problem, and at night also lot of problem. They have asked for e-rickshaw 10 people. There, but not declared, but I declared 2 e-rickshaw to you. So you have no problem for 2 and 4. And ask the lady prepared innovator dessert cup is excellent, delicious made to each and everybody for celebration for welding. All the best. Nothing to say. If you need as a any difficulty, you can approach me, or my card is Deepak Bhai, email and other thing, and I'm with you. Okay.
Thank you so much, sir. As a student who will be leaving campus, I'm very excited that the jury will have. Going to save a lot of time and energy. Thank you so much, sir. Thank you. I now request to award winners. If you could please, yes, thank you, sir. Beginning with the cultural events. First, we have the solo singing event. In second place, the award goes to Shaili Sen. Shaili, please. In the first place goes Banerjee. here I recollect her. Next, for the solo dance competition, in third place we have Mahima Sharma. Second place we have Vaibhavi Wagmare. And the first place goes to, any guesses? You are right, it's Pritha Bal. Thank you so much, Nitin sir. Thank you. I now request Dr. Somen and Harsh sir to join us on stage for awarding the faculties. We will now, sorry, sir. Yeah. We will now bestow prizes upon the winners for the scientific events, starting with the public health quiz. In second place, the winners are Team Nitrogen Fluoride, Harleen Kaur and Ankit George Thomas. Abhishek Ghosh and Shreya Singh. I call upon stage ma'am and Veena ma'am to bestow hospital administration quiz. Second place and registration quiz. In first, we have Team Med Masters, Avantika Baslial and thank you, ma'am. Thank you so much. Next, we will be announcing one of the most exciting scientific events that have taken place this year. The first time is hosted a Model G20 Summit. And for this event, I request Shalu ma'am to please join us on stage. The delegate of Russia and Mexico, that is Subhashri Panda and Harleen Kaur. Thank you, Shalu ma'am. Thank you so much. Call on Dr. Maha and Dr. Yashob to bestow prizes on our winners. The High Mention Award goes to the delegate of Brazil, Abhishek Ghosh. And finally, the Best Delegate Award goes to the delegate of Saudi Arabia, Pritha Bal. Thank you, sir. I now call on stage Medha ma'am and Priyanka ma'am to award our winners. The next event, that is the final scientific event, we have the winners of the scientific poster presentation. The runner-up award goes to Shreya Singh. Her presentation was on enhancing early intervention, a One Health approach to bridging gaps between NICUs and DEICs in India. Thank you so much. For the first place, I call on stage Dr. Shabana. Please join us. Goes to Chandra University. Dr. I request someone from the stage to kindly collect Dr. Dogra's award on his behalf. Their topic was assessing knowledge gaps and utilization patterns across end of announcing all the winners. I now call on stage Girika Sara. They are the ones who managed Zerja, so we request you to join us on stage. Apurva sir, if you could. News dessert cups are remaining. Very decided to give make sure to give them before. Sir has already. And with that, we have come to the end of the prize distribution. Before Devi joined us, so Devi came first singing competition. Let's have a loud applause for this wonderful conclave now draws to a close. It is my privilege to call upon Professor Suman to deliver the vote of thanks.
So, ladies and gentlemen, my dear students, students from other colleges who has come here to participate, our honored guests, esteemed faculty members, very good afternoon. So as we mark the conclusion of the 7th ACES, which is our annual health conclave of IIPG, let me take this opportunity to reflect on this last 3 days journey that we had. Particularly this year is a bit important because, we have clubbed it with the 31st annual state conference of Indian Association of Preventive and Social Medicine Gujarat chapter and the 13th annual state conference of Indian Public Health Association Gujarat chapter. So this journey for the last 3 days needed actually lots of preparations, dedications, hard works of several members of the IIPAG family. And I just want to thank all of them. We are thankful to our colleagues who have stepped forward with full force for months of preparations, countless morning meetings that we had to prepare for and plan for each and every minute details. Naming a few, maybe doing injustice to others, so I will not do that. So because as a family, we are up to this. Administrative team have been superb in their ensure a very glitch-free arrangements altogether. More than 450 registrations, 250 students who have put in a lot of efforts to make any magic. So let us cheer. Also, Jazz caterers needs to be excellent all through the event to make the life very comfortable for all of us students of PhD. Now your event bit of decorative news, premises, your backstage support, your on-stage support, participation in all the activities for which we do was really, and the first prize on day one, Friday. That will be commendable. So a loud cheer for all of you. I'm sure we have learned from who have shared with us during the last 3 days, shared their views in the area of antimicrobial resistance, non-communicable nutrition, strengthening climate action, sustainable hospital operations. So this is really an opportunity for all of us that we look here. Finally, others for the event, UNDP, UNICEF, State Health System Resources, Nair Energy, Astral Foundation, and of course our very own Nitin, has been our patron from the Heart Foundation Institute, who has generously supported every year. So we are very thankful to all of you, of the director, registrar, the entire faculty members, administrative staff, colleagues at IIP. A vote of thanks and look forward to the next year. But before I do that, I also request President of the Public Foundation, Dr. Sanjay Zotpe sir, who has just joined us to share a few words to conclude the event, sir.
Thank you, Somen, and obviously I'm very brief. Just wanted to congratulate the leadership, Professor Saxena and Senna and all the faculty members for this important initiative. Every organization this year, the conference of joint and IPA, that has given us an opportunity to act with the faculty from medical institutions. And I learned that the scientific program well. So congratulations to all of you. And I'm sure our students and participants have cherished and enjoyed the conference. And thank you so much.
Thank you, sir. So while we conclude this, I have a special mention. I want to introduce Dr. Bina Joshi, ma'am. If you can just wave your hand out there. So, for a moment that we are starting. She is a Deputy Director Rank Officer at the National Institute of Research in Reproductive and Child Health, Mumbai. And she is heading the Health Technology Assessment Resource Hub at NIRCA. So I know many of our students from Maharashtra want to look forward for your internship dissertation. Many of our students, several of our students have joined RCH, done their dissertation, and have been absorbed and working with her team. When we conclude the main event, I'll introduce her, and during the lunch, so you feel free to with her. I should be very happy to discuss any career options or questions that you.
Thank you so much. And now, before we officially conclude this remarkable event, I request everyone to rise for the national anthem. Following the anthem, we will gather on the side stage for a group photograph.
पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे